Okay, we're going to start with chapter 11, but I'm not going to go into a lot of detail because you have had, should have had some nutrition and importance of nutrition in some of your biology classes and in fundamentals. And nutrition is something that we all should be aware of already. And you can read my slides and you can read what's in the book, but we're going to talk a little bit about the importance of maternal nutrition and what's recommended for the pregnant woman. We talked last week about recommended weight gain. Normal weight should be 25 to 35 pounds. If she's underweight, we want her to gain a little more. If she's overweight, we want her to gain a little less. Usually, during the first trimester, if she's an average weighted female, we want her to gain 1 to 4 pounds in the first trimester, followed by a pound a week in the last 2 trimesters. If she's underweight, we want her to gain a little more than a pound a week during the last 2. Overweight, under a pound a week. And if she's obese, about a half a pound a week, because we don't want her to have health problems. Risks of obesity, mortality, and that's often due to chronic diseases. Preeclampsia, which we'll talk more about that during the semester, but that is pregnancy with high blood pressure, running the risk of having seizures, protein in the urine, lots of problems. Gestational diabetes, thromboembolism, postpartum hemorrhage, an increased rate of cesareans, and oftentimes the offspring will have a greater likelihood of obesity, be predisposed to obesity. Specific nutrients are important for a pregnant woman. Carbohydrates, we talked about this last week, and it's the complex carbohydrates, those things that can give her more energy throughout the day. Eating more fiber because it's essential for bowel function. And if she's not eating enough carbohydrates, then protein will start breaking down and be used for energy for the baby to grow. Protein is essential for maternal tissue hyperplasia and hypertrophy and for the growing baby, and we need protein for energy metabolism. Fats are also used for energy, and these are the good fats, the monosaturated, the polyunsaturated omega-3s, and the DHAs. These are more completely absorbed, and they are very essential for fetal growth. And no potato chips. We don't need the trans fats. Those are very unhealthy, and we have to be very careful with eating too much saturated fats. Dietary intake of DHA are good omega-3s, reduce the risk of preterm births, preeclampsia, and low birth weight. And it may also enhance fetal and infant brain development. And this is what's found in oily fish. But we have to be careful because of the mercury that can sometimes be in these type of fish. And it's not fried catfish. These are your white fish. Calcium and phosphorus, mineralization of fetal bones and teeth, and buffering of our acids and bases. Iodine is also very essential, and a deficiency can lead to cretinism. That's why we say we need to take in iodized salt. Sodium is important for metabolism and for regulation of fluid balance. This doesn't mean to eat a whole lot of salt. This means what your normal intake of salt would be in the foods that you're eating, not from the salt shaker. Zinc is used for protein metabolism and the synthesis of DNA and RNA. It's essential for fetal growth and lactation. Do we need to take extra zinc? No. It just needs to be included in our normal diet. If we're eating right, we're going to get the right amount of zinc and sodium in what our food. Magnesium for cellular metabolism and bone mineralization. Of course, iron, our oxygen carrying capability of the blood, and helps to expand the maternal blood volume. Our good green leafy vegetables. Vitamin A for epithelial cells, the synthesis of glycogen, healthy eyes of the fetus. Vitamin D to absorb and utilize calcium and phosphorus. How are we best getting all this? Taking our prenatal vitamins. Vitamin E for antioxidants and health of cell membranes, and vitamin K for the synthesis of prothrombin. C for connective tissue and development of the vascular system. The B vitamins for cellular respirations and glucose oxidation, and for energy metabolism. So, our nutritional needs during pregnancy, the postpartum period, and lactation. So, changes to our nutritional needs, there's no change required for pregnancy. We have the same nutritional needs that we need on a daily basis, whether we're pregnant or not. Our increased needs are in calories. Add 300 kilocalories per day. Our increased needs of carbohydrates and our increased needs of protein. Add 60 grams per day. These are needed for energy and for fetal growth and development. Vitamin intake. A is dependent on her age, and C is also dependent on age and whether she's lactating. Where's the best place to get these? Her prenatal vitamins, and she needs to take them every day. Same thing with the other vitamins. And you can read all of this without me going into all of it. Vitamin D deficiency, it is more common now than was previously recognized. Why? Because we're not getting out in the sun as much as we used to. So a screening for this, currently we don't have a screening for it, but some women do have a deficiency in vitamin D. Women at risk are usually vegetarians, those who have had limited sun exposure, and some ethnic and racial groups who have dark skin. Her healthcare provider will have to treat this, and usually it can be safely treated with 1,000 to 2,000 IUs a day, and that comes from the Association of Gynecologists. But that has to be prescribed by the healthcare provider. Increased mineral requirements of zinc and iodine, and all of this should be included. It's usually, the prenatal vitamin is usually called Materna, and these elements will be there. Magnesium and iron, you can read those. Iron, usually the amount of iron that we need, that's the reason for taking prenatals, is because we usually can't get the amount that we need during pregnancy through diet alone. And some women often are still anemic and may have to take extra iron. And you can read about thiamine and niacin that are important. Niacin we can get from eating broccoli or fish. Prenatal vegetarians. This is a new population. Well, vegetarianism is not new, but we are seeing the increase of vegetarian diets in pregnancy, and it's very important that we're knowledgeable on how to direct these women on how best to eat. Lacto-ovo vegetarians, that includes milk, dairy products, and eggs. The lacto-vegetarian includes dairy products but no eggs, and vegan consumes no animal products at all. So, vegetarian diets, they They usually need complete proteins, but different types of plant-based proteins like alternatives to dairy and meat. They still need to have adequate calories. They still need a daily supplement of calcium and a daily supplement of vitamin D. So we need to know what type of vegetarian they are. Oftentimes, vegetarians run the risk of being very anemic. So vegans need to have a daily supplement of B12. And if they are not drinking any soy milk, they may need to take some calcium and vitamin D supplements, but they also may have low iron and zinc levels. Their best sources of what they need are found in animal products. High fiber intake may reduce their mineral availability. So we have to watch all of those things and emphasize that they consume foods that contain calcium, iron, and zinc. So here's the vegetarian food groups. For a mixed diet, for a lacto-ovo-vegetarian, a lacto-vegetarian, and a vegan. And it's important for us to get some information to help them know what how they can adjust their diet while they're pregnant, what's safe for them and for their baby. As you see, fruits and fruit juices are very important all the way across. Where they'll be lacking is where they're not eating meat, so they need to make sure they get some protein in there. Okay. Culture, how this can affect nutritional intake and status. We talk about culture a lot in this class. It's very important. If she's nausea and she's vomiting, having heartburn, that oftentimes causes her not to want to eat and not to eat the right things. So, we need to help her overcome those, and that's some of the things that we've talked about already in Chapter 10. If she's using complementary or alternative therapies, we've got to know what kind of herbs that she's wanting to use, because some are safe and others are risky, and we have to read about all of them because there's always something new coming out that someone may be wanting to use. Artificial sweeteners. They're usually recognized as safe, but we need to always be aware of what she's using for sweeteners and make sure that they're still deemed safe, because some are considered unsafe even if she's not pregnant, or some may be cancer producing. So we need to read about those and make sure we have a good understanding. Energy drinks, use cautiously, and especially those who have high caffeine. Mom doesn't need to be intaking those high caffeine drinks. Foodborne illnesses, we want to be very careful of salmonella. She can get that through uncooked chicken, raw chicken, turkey. Listeria, we have seen that in a lot of unwashed lettuce, especially in the romaine lettuce issues. Mercury in fish. Low mercury fish, and they're still oily fish that we can still get our omega-3s, include canned tuna, shrimp, salmon, catfish, and pollock. Now, these, when we say catfish, she can eat those grilled, broiled. We want to limit the amount of fried. Lactose deficiency or lactose intolerance. She might not be able to drink milk, but if she has milk in a cooked form, sometimes this can help. Or if she drinks a cultured or fermented dairy product like yogurt, or over-the-counter enzyme tablets or drops might help, or a lactase-treated milk, which is like a lactose-free, may help. a lot of moms have lactose intolerance, or if they drink a lot of milk when they're breastfeeding, sometimes they'll end up giving their babies a lactose intolerance. Foods have a symbolic significance for a lot of people, and a lot of times food is related to major life milestones. So we need to understand where her beliefs are about food and pregnancy and variations within the different cultural groups. What are there normal foods that they eat? Are these safe to eat while she's pregnant? And there's some good information in your book for you to read about. Cultural factors affect our food preferences and habits, and so we need to know what her normal diet is so that we can help her know, is this good for pregnancy or not? What's okay to eat raw? Definitely not sushi. Psychosocial factors. Sharing of food is a symbol of friendliness and warmth and social acceptance, and some foods are associated with status. But we have some socioeconomic factors that prevent us from buying the high quality foods that we may need during pregnancy. So, we don't want to make women feel bad if there's some foods that she can't afford. We all know groceries have become very expensive. So if there's some high quality foods that she needs during pregnancy, and there are some socioeconomic factors that are preventing her from getting these, there are services available. So we need to make these services available to her. We need to understand what her attitudes and feelings are about pregnancy that might affect what choices of food she has. And sometimes people eat as a substitute for depression or emotions that they may be having. It gives them comfort. So we need to identify all those things that might affect good food choices, but also bad food choices. Eating disorders, we can't go without talking about anorexia nervosa. I can't talk right. Anorexia nervosa. This is an extreme fear of weight gain and extreme fear of fat, and it's very bad for a woman who's pregnant to also have this eating disorder, because she's pregnant, she sees herself as fat with a distorted body image, and she can be severely underweight, and this is very detrimental to both her and a growing baby. And her dietary intake may be very restrictive. So she may also excessively exercise to prevent gaining any weight. And so this could be very harmful to both she and the baby. Bulimia is when they binge eat and followed by purging, making themselves vomit. Or sometimes they may use a laxative or diuretic. Sometimes these individuals are very difficult to identify because they will look like they have a normal to nearly normal weight for their height. So we have to be super cautious. Oftentimes electrolytes will be all out of balance. Women with bulimia can become pregnant, but this self-induced vomiting may produce some complications like hyperemesis gravidarum, and that is like emesis on steroids. She cannot stop vomiting, and this vomiting will cause a severe electrolyte imbalance to the point that she may need to be hospitalized. Pica, this is eating something that is non-nutritive like clay or dirt, laundry starch, cornstarch, soap, baking powder. Sometimes they don't want to eat anything but ice or freezer frost, burned matches, paint, sometimes even ashes. And this is one of those disorders where they're just craving something like this, and that's what they eat, but they are not getting any nutrition from it. And it's a persistent eating of non-nutritive substances. And most women who practice pica, they only do this when they're pregnant. They have this craving for eating clay, but they are not going to get nutrition out of that, and they can have a terrible metabolic balance. Iron deficiency anemia is the most common concern. Even if she ingests laundry starch or certain types of clay, she may have an iron deficiency. And it'll interfere with iron absorption. If she's eating ice or freezer frost, she won't have an appetite and she won't gain weight. If she eats starch, she'll have excessive weight gain. If she eats a lot of clay, she will inevitably develop a fecal impaction. So to assess for pica, she might be very embarrassed and she may be fearful of criticism, but it's important that we use a non-judgmental approach and assess if she if she's having an iron imbalance, we can assess if she may be eating something other than what she's supposed to. And we need to give her information so that we can hopefully eliminate this practice and get her to eating the right things instead of dirt. Non-fat powdered milk is a good substitute for laundry starch because they mainly do that because they like that texture. Frozen fruit juice instead of ice, or sucking on hard lemon or mint candies may help decrease the pica-related cravings. So, recommendations for weight gain and nutrient intakes in the adolescent. We know adolescents do not eat right. They want to eat junk food. So we want to start with dietary reference intakes for non-pregnant teenagers, and then add nutrient amounts recommended for all pregnant women. Young adolescents need to gain more than older ones do. So naturally, an adolescent is not going to give you a food diary for a whole week. So what's more digestible for them? Tell me what you ate in the last 24 hours. Or keep a food diary for me, what you eat for breakfast, lunch, supper, and snacks for one day, so that you can get a good idea of how this pregnant adolescent eats and how you can help them learn to eat better, because they're still developing and they have a developing baby, so you're really needing to help both of them. Caloric needs vary widely depending on whether this adolescent has finished growing, if they're still growing, and what their physical activity level is. They may need as much as 50 kilocalories per kilogram a day if she's a very physically active, young, pregnant adolescent. And if she's having good weight gain, then we know she's probably having a good caloric intake. Adolescents are usually going to need supplements for iron, calcium, folic acid, zinc, vitamin A, D, and B6. So, what are the basic factors when I'm trying to talk to an adolescent who's pregnant? Their eating patterns are usually not regular. They usually don't eat breakfast, and they snack a lot. So their day-to-day intake is very different. If I can assess a pattern in their eating habits, then I can help them balance their nutrition better. So assess their eating patterns. Like I told you, over time, I'm getting a single day's intake, but then, okay, then what did you eat the next day? All right, then what did you eat on Thursday? And I want to see a pattern so that I can counsel them towards correcting any kind of deficiency they have. So you start small and then you get where you can see a good pattern over time. Okay, so teaching strategies for the adolescent nutrition during pregnancy. The community setting offers effective teaching environment. You don't want to teach an adolescent in a room full of women who are in their 30s. You want it to be with other teenagers to help teach them. And with the adolescent's consent, others may be included, like the family members that may be involved in meal preparation, the expectant father. So it's very important to involve who the adolescent is comfortable with in helping them eat the way they need to eat. A concrete approach is best, and it's more effective, and it's less stressing over the long term. Group classes are effective, especially if you include other teens and you don't just bring the adolescent in with mom. You try to have a group approach and make everything concrete as you can. So we want to assess what's her height, what's her weight, what pregnancy weight gain has she had, what are her labs, especially the H&H. Any malnutrition that we can find. Is she having any constipation, anorexia, any heartburn? What's her dietary history? So as I said before, we want to see a pattern, but it might be easier to get a 24-hour diet recall first and then get her to complete at least 3 days so that we can see a dietary pattern. We may even get her to fill out a food frequency questionnaire. So how often a day or how a week are you taking in these types of foods? How many colas are you drinking in a week? Are they Cokes? Are they Monster drinks? What are they? But we really want to get as accurate reporting as we can so that we can help her to have a healthy baby and she can stay healthy as well. Okay, nutritional counseling for breastfeeding versus formula feeding. Formula feeding moms, their dietary requirements usually will return to pre-pregnancy levels, and to help her get her weight back down, we'll reduce her caloric intake by 300 kilocalories a day. We usually want her weight loss goal to be 1 to 2 pounds a week, and we'll refer her to a dietitian if she's wanting to be placed on a weight loss program. We really want to teach her about her dietary needs so that she can meet her infant's nutritional needs, especially if she's going to choose to breastfeed. Breastfeeding moms need to increase their caloric intake to 200 kilocalories a day over what her pregnancy caloric intake was. Average about 2,500 to 2,700 kilocalories a day. This is to help support lactation for the baby. Okay, and this is a table that's in your book, and this is actually the last slide for Chapter 11. It's a daily food plan for pregnancy and lactation. It's very important in helping teach the mom types of foods that she can eat, where her food sources are, to help not only maintain her health, but also maintain the health of her baby. Okay, that's all Chapter 11, and now we're going to get into a digest of everything that's hopefully important to help you remember, and also get into Chapter 13.